Ladies and gentlemen,
Уважаемые дамы
we welcome you to this panel session, the role of healthcare insurance in the development of healthcare. I think a very timely topic, a very relevant topic, a topic that concerns us all, and I'm very pleased to be here today. My name is Tadzio Schilling. I'm the CEO of the Association of European Businesses, the leading business association in Russia, but we are also cooperating very strongly now with organizations and businesses in Central Asia, and that's why I have the pleasure to be here with you today. On the panel you see our distinguished panelists, Amrilo Shadievich Inayatov, Minister from the Ministry of Healthcare of the Republic of Uzbekistan, Dr. Ashina Khalakdina, WHO representative and head of the WHO country office in Uzbekistan, Ulugбек Yegamov, director of the Agency for Pharmaceutical Industry Development, and we have a small echo here, but I'm sure it will go away. Wang Jian, Chairman and co-founder of BGI Group, Zafar Vahidov, partner of Vahidov and Partners. So let me start this panel discussion with a few general assessments, and then we kick it off with the in-depth deep dive into the announced topic. So first of all, the first thesis is that the role of global healthcare is growing. The world population is expected to grow from 7.9 billion to 9.5 billion by 2045. COVID and other recent healthcare crises have clearly shown the importance of resilient and performant healthcare systems. And spending in healthcare is also on the rise. We reach globally 9 trillion, which is about 11% of global GDP. And then you have obviously outliers such as the US, which are getting ever closer to about 20% of GDP, or at least 16, 17%. And then you have some countries which are not yet at this level. Thesis number 2, pharmaceutical business is becoming also more and more attractive. It's a very strongly growing, highly innovative industry. Developed healthcare, innovative drugs are in high demand, and investment flows into the pharmaceutical industry are quite impressive and stable. Also, if you look at the current situation with numerous geopolitical tensions, with a global division on the rise, we can say that one of the few sectors that is still exempt from sanctions and restrictions is exactly pharmaceutical and healthcare and medical devices. I think this is a very, very welcome fact, and the fact that we cannot cherish enough. So in the modern world, healthcare insurance has become an integral part of the healthcare system in most countries, and a key tool to ensure the availability of drugs and quality of medical services. And best practice show that the introduction of healthcare insurance significantly increases the duration of people's lives, their longevity, and it also impacts other key macroeconomic and social indicators such as productivity, education levels, and other social indicators. So harnessing all the actors in this field, government, business, NGOs, research, academia, is critical. And today we are going to discuss the topic on the role of healthcare insurance, and we're going to look at the impressive results and reform efforts of the Uzbek government, about the achievements of the past 3 to 5 years, and we obviously also want to look ahead. What can we expect? What is in the pipeline in terms of projects? We are also going to look what opportunities, business opportunities, we can find in the healthcare sector. And we're going to look at some milestones and some highly successful projects that were implemented and what lessons can be drawn from this. And with this, without further ado, I would like to pass the word to the Minister. On November 9, 2018, the President of Uzbekistan has noted the necessity to introduce a compulsory medical insurance system in the country, and the phased pilot was supposed to start in 21 and then gradually be scaled out to the entire country via various pilot regions. And so I would like to pass, мне бы хотелось предоставить вам.
I would like to give the floor, dear Your Excellency, Minister, to discuss more broadly about these programs and reforms and outcomes and achievements of what we are supposed to expect in coming future. Dear sir, please, floor is yours.
Good afternoon, ladies and gentlemen. I am glad to see you today in our forum. Дорогие гости, прежде всего я хочу
First of all, let me express my sincere gratitude for your kind attendance, for sparing your available time to attend today's event. And dear ladies and gentlemen, all of us are very revealed that in 2020, the world was hit by COVID pandemic, and the pandemic actually hit hard even the countries with even the well-developed healthcare sector, where the pharmaceuticals and healthcare were very strong. But still, these countries, corona crisis, exposed their weaknesses, and of course, all of the countries of the world embarked on reforms of healthcare sector due to the challenges which have been posed by coronavirus pandemic. Therefore, the President of Republic of Uzbekistan came up with the initiative of fostering reforms in healthcare sector in Republic of Uzbekistan, and these reforms are underway intensively in our country. And first of all, we should mention about mandatory medical insurance. You know that we are taking steps and we are taking gradual approach on moving towards medicine insurance. As well as you know, in Sirdarya province, we have launched the so-called pilot project on healthcare. And first of all, we have started working at the so-called primary stage, primary level of healthcare, and we have engaged international experts from WHO, and considering all the recommendations by WHO, we have started to establishing the brigades of universal patronage brigades. So it was a teams. I would say we had one therapist and 3 or 4 nurses who have been in one team with the therapist, with general practitioner, and so together we have been working with this, and actually each of these teams was serving to 2,000 of people, and the main purpose of this brigade, of this team, was prevention and ensuring nutrition, proper nutrition, as well as prevention of various diseases, early diagnostic, and of course proper treatment. So for these purposes, we at the initial stage of the initial, I would say, level of healthcare, we also had our polyclinics, and also we have our other hospitals, and considering the current state of the equipment, we have also started re-equipping them, rehabilitating their facilities and their other facilities and equipment. We came up to understand, do they deal with lab tests? Do they deal with other diagnostic tools? And we, at each each stage of medical services, we have started embracing particular, I would say, actions which they are doing in the framework of a certain package. So 70 types of drug and 20 type of various medical, I would say, consumables have been delivered for absolutely for free for our population. So it actually helped us if we have some endocrinological, for example, disease or cardiovascular disease. So for these patients, we are having them under category D, and we are exercising the monitoring for them, and whatever drugs they might need it, since they have a chronic disease. So whatever drugs they are consuming, the government is covering all the expenses by providing these drugs for them for free. And in Sirdarya, I am talking only about Sirdarya province, that we are now embarked on complete digitalization of all the business processes, work processes of medical entities in Sirdarya province. And in Gulistan city in Sirdarya province, we have remote areas. We have there 12 hospitals and dispensers. Would it be endocrinology, cardiology, ophthalmology, as well as skin disease, dermatology. We have consolidated them in one. We have created Gulistan Medical Cluster, and of course it helps us and in managing this one, and of course we are introducing new mechanism of managing the system. So we have given a financial, I would say, independence to medical entities so that they will manage their funds themselves, and it created a lot of conveniences for our medical entities. So considering what do we have, each of the doctor, considering their daily load, we are giving them an opportunity to manage their daily schedule also by themselves. So based on what have been already performed by them, and we have recalculated all the workload. And also we have to keep in mind that in the framework of our reforms program, we have made significant progress, including the achievements such as number of visits. It has significantly improved, and of course, would it be people, visitors and others, including those, people were not trusting in medical services, and they were thinking that sometimes the hospital are not properly equipped, and they were not trusting the doctors while hospital visits. So, of course, we have no option but to resolve these issues ourselves. And therefore, when we're talking about the medical insurance, on mandatory basis, it helped us to attract more visitors to the hospitals, because people started trusted in this assistance which might be rendered by the doctors. And actually we had a reduction of visits to our so-called specialized doctors, such as ophthalmologists, endocrinologists, and etc. It dropped by 7% because the people were started visiting therapists more, and in family polyclinics, we, due to our these universal patronage teams, our I would say general practitioners, their level, their professional level has elevated, and the people were started visiting so-called daily visits to the hospital, and government was providing all the necessary, I would say, health care to people, and as a result, indeed, it had improved relations between patients and the hospitals. And of course, the workload of so-called treatment in hospital, the load was reduced by 4%, and so we can see that the initial stage, the initial, I would say, level of healthcare, we have managed to improve the efficiency of the services, and I would say that the from 45 to 22%, we had a reduction of, I would say, hospital treatments who were not justified and who were, frankly speaking, unnecessary. And therefore, doctors were keeping our sometimes patient in hospitals for 5 days. They were simply occupying beds, but so the people had no indication to stay in the hospital. Therefore, we have managed to reduce these indicators twice as much comparing to initial level. And I'm very thankful to WHO also for cooperation in this extent. And in Sardegna province, actually, we are promoting these mechanisms of healthcare related insurances, and started as of January 2024. We are going to introduce this system all across the country. Of course, in future, when we're talking about transition from current system to medical insurance system, whatever we are doing at the moment, these things are about to create a platform for mandatory medical treatment, and for this purpose we need to have digitalization in place in medical entities. We need to closely connect not just the insurance but also digitalization process. But still, we should be well aware that for digitalization it should be more even intensively progress across healthcare sector. And let me share with you with some statistical data at the moment. Let us move to our next slide. You can see that here the number of population in Uzbekistan exceeds 36 million of people, and the population at the working age is around 19.5 million of people. So remaining people are underage or people who are seniors, who are retired already. And I should also mention that among this working age population, only 33% of them are currently employed. And now, please kindly focus your attention that these 33% of population and 17.8% of them are employed in so-called official sector, which means that they are officially registered, while remaining 15.4% are employed unofficially in so-called shadow economy. So we have also population who are working abroad. It's around 5% of the total number of population, and also we have economically inactive population. I mean, our students, for example, who are not seeking the job at the moment. It's around probably 2%, and we have unemployed persons who are about 3 and 7% in total. essential. So, according to the global statistics, if we would like to shift to so-called mandatory medical system, we are at the state model of medical systems when the government is providing patients with everything. We need to have at least 60% of economic active population. They should be employed officially, not in shadow economy. That is the issue. So, at the moment, we are intensively progressing with our efforts, and at the end, at least we do forecast that by the end of 2024, at the moment, I have mentioned that we have over 5 million of people who are employed in so-called shadow economy, who are not employed officially, but we are going to officially register them. And we will help them to move out of the shadow to sunlight to official economy, and it means that we are going to create additional new jobs for them, and by providing them with employment, we will be able, and we will be absolutely ready to transit to mandatory medical insurance. And by the end of 2024, we will be able to, we will be ready to shift to this platform of mandatory medical health care. Thank you so much for your kind attention.
Спасибо большое.
Yes, indeed. Thank you so much, Mr. Inayata, for your valuable insights and which you have shared with us under leadership of you and your team, and indeed with under such a short term. You are meaning that by the end of 2024 we are going to transit to mandatory medical system. Unfortunately, we have only two questions. We do not have much time for our discussion. Only 1 hour has left, so I will come with two questions addressing to you, sir, talking about reforms which have been implemented within last 5 years. What has been done in the field of attracting investments and investors in this area? And if we will look far beyond 2024, what will be the priority in mid and long term for development and strengthening of healthcare system in Uzbekistan? Thank you so much.
Спасибо, уважаемый спикер. Очень важный вопрос. Конечно, без привлечения внешних инвестиционных проектов мы просто не можем трансформировать нашу медицину, медицинское образование и так далее. Очень правильный вопрос задавали. За последние 5 лет в здравоохранении Узбекистана было привлечение инвестиций в размере до $1 миллиарда. В частности, из них $300 миллионов в рамках 9 инвестиционных проектов под государственные гарантии, $200 миллионов в рамках 45 проектов государственного частного партнерства, $450 миллионов на организацию 160 частных клиник с участием иностранных инвестиций, $50 миллионов путем прямых инвестиций. На сумму $100 миллионов были привлечены грантовые средства. Наибольшая доля объема инвестиционных проектов под государственные гарантии приходится на фонд ЕДСФ, Корейского Экзимбанка и Исламского банка развития. Тесное сотрудничество было также налажено с Международной ассоциацией развития, Кувейтским арабским экономическим фондом развития, Саудовским фондом развития и немецким банком KfW. Наличие благоприятной инфраструктуры и необходимых условий в Узбекистане, усиление прав инвесторов законом, интерес иностранных инвесторов к нашему государству возрастает из года в год. Соответственно, увеличивается объем инвестиций. Например, говоря о возможностях и льготах, представляемых частному сектору медицины, в этом направлении было принято 6 указов и постановления нашего уважаемого президента. Принято решение обеспечили необходимые условия и возможности для частного сектора, где учреждения были освобождены от уплаты налогов и таможенных пошлин. Любые проверки проводятся с разрешения бизнес-омбудсмена. В результате за последние 6 лет количество частных клиник увеличилось с 2,5 раза до 8 тысяч раз. Сегодня с участием иностранных инвестиций функционирует 160 частных больниц. Это, конечно, мало, но наша цель – это повысить как минимум в 10 раз. Объем инвестиций в медицину Узбекистана в ближайшие 5 лет увеличился в 5 раз, и планируется эту цифру увеличить до 5 миллиардов долларов. В частности, 1,3 миллиарда долларов в рамках 13 инвестиционных проектов под государственной гарантией, 1 миллиард долларов в рамках 8 проектов, согласованных в рамках государственного частного партнерства, 1,5 миллиарда долларов в рамках 200 перспективных проектов на основе ГЧП, 1 миллиард долларов на оснащение частных клиник современными оборудованием. Позвольте мне рассказать вам о крупнейших проектах в рамках государственного частного партнерства. В этом году в Нуравшане разрабатывается предварительная документация по строительству современной многопрофильной клиники вместимостью 1500 коек стоимостью 600 миллионов долларов. А также индийская компания Akash Healthcare готова осуществить прямые инвестиции в размере 100 миллионов долларов в медицину в нашей стране. Организация центров лучевой терапии в Ферганской, Самаркандской и Хорезмской областях общей стоимости 21 миллионов долларов. При поддержке международной финансовой корпорации готовятся предварительные документы по созданию многопрофильных больниц на 750 коек в Фергане и на 600 коек в Андижане и Бухаре общей стоимостью 275 миллионов долларов. Создание центра лучевой терапии при Центре детской онкогематологии. Создание турецкой компании Çalık Enerji больницы на 600 коек в Гуждуване. Будущее нашей медицины напрямую связано с развитием частного сектора. Без частного сектора мы не можем развивать и трансформировать нашу медицину. Это создает здоровую конкуренцию среду в системе, повышает качество медицинского обслуживания и приводит к экономии бюджетных средств за счет снижения нагрузки и государственных учреждениях. Вместе с предпринимателями в ряде областей медицины мы начали реализовывать некоторые еще проекты. Во-первых, услуги медицинских лабораторий организуются на основе аутсорсинга во всех районах Ташкента и Термеза, а также в районах Шерабад, Ангор, Кумкурган, Байсун. Мы также готовы провести этот эксперимент в 170 районных и муниципальных медицинских объединениях. Мы начали практическую работу с более чем 10 иностранными предпринимателями, которые проявили интерес в этом отношении. Во-вторых, сегодня нам необходимо 15 МРТ и более 200 МСКТ для наших больниц по областным и районным уровнях. В качестве решения этой проблемы мы предложили предпринимателям установить оборудование МРТ и МСКТ в самом учреждении и продавать предоставляемые услуги. А мы будем покупать все виды услуги гарантийно. В-третьих, 15 из 74 медицинских техникумов, имеющихся в республике, также могут быть переданы в доверительное управление. В этом случае главным требованием будет введение европейского и американского стандартов медицинского образования. В-четвертых, быстрая и точная диагностика пациентов в онкологическом центре и его филиалов, так как у нас недостаточно современного оборудования для лечения. В этом направлении мы также обратились с предложениями к частному сектору о создании рентгенорадиологических центров на основе договора аренды. Когда такие центры облагаются налогом, их услуги приобретаются государством в рамках гарантированных услуг. В-пятых, мы разрабатываем проекты по созданию многопрофильных больниц на 1,5 коечных в каждом регионе республики на основе ГЧП. Мы также хотим предложить передать предпринимателям на принципах государственно-частного партнерства около 10 республиканских клиник, в том числе республиканские специализированные центры урологии, нейрохирургии, республиканские клинические больницы номер 1, а также для решения проблем в области репродукции, мы также хотим привлечь инвесторов и создать частные отделения для экстракорпорального оплодотворения с высокотехнологичной лабораторией в перинатальных центрах каждого региона. Благодарю за внимание.
Thank you, dear Mr. Minister, Excellency, for such an uplifting and inspiring outlook at the end of this week. For someone who represents foreign investors, your words are music in my ears. And I would like now to present you the next speaker, Dr. Ashina Khalagdina, WHO representative. You know that WHO has been over years, over decades, the most authoritative and experienced healthcare organization, has addressed a multitude of global healthcare emergencies, helped countries to cope with these problems. And I'm sure that, the continued support and expertise that such an authoritative and renowned organization can provide to such an ambitious country as Uzbekistan is a very clear win-win case. So, dear Dr. Ashina Khalagdina, please share with us, with the audience, your report about how the reforms are progressing, what recommendations we can make at this stage, and how you see the outlook for the immediate future. Please, the floor is yours. And if we can try to stay within the approximately agreed timeline, then this would be very good. Thank you so much. And a warm welcome also because you said that you just arrived in Uzbekistan. So I think from the whole audience, a warm welcome and good luck in your mission in this country.
Thank you, and good afternoon. Excellency Dr. Amarilo Inoyatov, Minister of Health and Medical Industry, Republic of Uzbekistan, distinguished participants, colleagues, ladies and gentlemen. Since 2018, WHO has supported the Ministry of Health and partners in Uzbekistan in the design and introduction of a new model of healthcare organization focused on primary healthcare, or PHC, and supported by a new model of financing. Despite the COVID pandemic, the government has remained committed to the reform, and in November 2020, a landmark legislative package was approved, providing the foundation of the health system transformation. Moreover, the pandemic has confirmed the importance of planned reforms in several areas, including the removal of financial barriers for accessing diagnoses and treatment, enhancing the role of primary health care in identifying and proactively addressing the needs of the most vulnerable and those at higher risk, working closely with communities, and more generally, strengthening the core capacities of primary health care. The pilot work that you've just heard about launched in Sirdarya in July 2021, and it adapts international good practices to the Uzbekistan context. The gradual implementation aims to solidify the changes implemented, give extra time to implement pending reforms, and build more capacity, as well as develop an updated scale-up plan to other regions of Uzbekistan. The government's commitment is evident in that the work is underway with application of lessons learned in the last 2 years to scale up in the city of Tashkent and soon in Karakalpakstan. WHO renews its commitment and is ready to work hand in hand with the government of Uzbekistan. Although the implementation period has been relatively short, there are several achievements to be proud of. The establishment of the State Health Insurance Fund in 2020 as a single independent purchasing agency is one such landmark achievement, and it should be recognized that this fund has played a pivotal role in supporting the implementation of the health reform in Uzbekistan. The established governance structure of the State Health Insurance Fund adheres to international good governance practices in health financing. The fund's supervisory board has the potential to support the implementation and rollout while bringing together the Ministry of Economy and Finance and the presidential administration along with the Ministry of Health. Additionally, it provides some level of independence to the fund for making purchasing decisions. The governance arrangement of the fund is novel in the Uzbek public sector, and it can set the standard for good public sector governance in the country. Effective cooperation between Ministry of Health, Ministry of Economy and Finance, and the fund is a shared strategic vision on the state health insurance. And strong leadership can turn state health insurance reform into long-term success for the people of Uzbekistan. We encourage the government to consider a formal interagency task force to provide oversight and coherent direction to the fund going forward. The decision to rely on general tax revenues to finance the Uzbek health insurance system follows global best practices. According to a recent WHO report, general taxation is the most effective, equitable, and stable way to support progress towards universal health coverage in Uzbekistan. Our analysis showed that the employment contributions would generate very limited revenues to health sector in Uzbekistan, and introducing such contributions may adversely affect the competitiveness of the Uzbek economy, at least for the time being. Therefore, we highly recommend, for the time being, Uzbekistan continues to rely on a general tax-financed revenue base for the health sector, which is fully aligned with international best practices and WHO guidance. Gradually moving towards national-level pooling of health insurance budgets is the next step to get maximum value for money of public funds. Great progress in this regard has been made in Sirdarya, where health insurance budget pooling now takes place at the cabinet level, at the oblast level. The transition to health insurance medicine to ensure targeted spending of funds was announced by the President Shavkat Mirziyoyev in an address on December 20th, 2022. It is planned to launch medical insurance in Tashkent starting July this year. And there are very ambitious Ministry of Health plans to complete the digitalization of medical institutions by this day, and to know when, where, and what kind of treatment each patient received. There are plans to gradually introduce medical insurance in various other provinces, and WHO remains, as I said, committed to working closely, hand in hand, in support of the Ministry of Health. So, in summary, I congratulate the strong commitment of the government of Uzbekistan to rolling out health reforms into other regions of the country, and certainly note that the Sirdarya pilot provides a solid foundation for future health reform in the country. Really, in just 2 years, the country has managed to establish a strategic purchasing agency, start contracting health facilities and pharmacies, advance in the development of IT solutions for health, and reorganize the service delivery network in the pilot region. This creates a very good basis for future changes in the healthcare system and allows future changes on developed national capacity. Thank you very much.
Thank you, Dr. Ashina Halagdina. I think it was very sharp and to the point here in your report, the recommendations given from a perspective of international best practices about how to expand and solidify this system that was developed on the basis of this pilot project. Taking into account some other healthcare reports that your organization has been carrying out in Uzbekistan, notably about the main health risks, where, if I understand correctly, you say that the main health risks lay in non-communicable diseases. So we spoke about the extension of this system. What else needs to be done to address these major health risks that the World Health Organization sees for the Uzbek population and to improve the healthiness and livelihood of Uzbek people in the long perspective?
Thank you for that question. We are certainly working closely with not only the Ministry of Health, but various other partners, not only development partners, but really all sectors. And WHO we have all recognized, the world has recognized through COVID that lives and livelihoods go hand in hand. And we need to make sure that a healthy population supports the development of a healthy economy. As part of that, we have to recognize that having healthy people requires prevention of disease and really taking a public health perspective. And as you've seen from the minister's presentation on the pilot work that was done on primary health care, the concept is really to make sure people are healthy to begin with, and when they first start having any kind of illness, that they get immediate attention and health care, rather than waiting till they become extremely ill and the disease is so severe that it has extremely adverse outcomes. So really recognizing that all of society and all of government needs to be part of the solution to have a healthy population at all levels and regardless of all conditions, but especially focusing on the most vulnerable and the most at risk. So this requires an evidence-based approach. It requires analysis and a keen understanding of the extent of diseases in the population. You've mentioned non-communicable diseases, but of course we know that there is a myriad range of diseases in any population, and we have to be focused on local level conditions, local contexts, to understand that level of disease and the epidemiology of disease in local populations, so that we are better equipped to respond and to ensure that people remain healthy, and when they do get sick, they get the best, most effective care as soon as possible at the least cost to them. So that is the aim of what public health systems in governments and countries should be doing, and we call this universal health coverage. Thank you.
Thank you very much, and really best of luck in your mission here, and for the continued collaboration, which I expect will be most beneficial for the strengthening and realization of further healthcare reform projects. Now I would like to move to our third speaker, Ulugбек Egamov, Director of the Agency for Pharmaceutical Industry Development. В своем выступлении господин министр упомянул, сказал, что сложно передать.
Of course, he has mentioned that it is not easy to underestimate the role of business in implementing reforms. And of course, talking about the health care of population, I would like to ask you in particular, since you are head of the Agency for Pharmaceutical Industry Development, what do you think? What is the role of international business. What are the opportunities you see for international business, not for European business exclusively, but also for American businesses, for Chinese businesses, from businesses from all over the world, because we do appreciate that Uzbekistan is undertaking the policy of openness to all the partners. I think that it is very rare, but still it is very valuable to us, such approach. I mean, thank you so much, dear colleagues, the participants of the forum. Good afternoon. I'm sorry, I guess I will be coughing. Therefore, I'm very sorry if I will be coughing at the moment. So, indeed, you're absolutely right. Our agency is the only government body which will be bridging pharmaceutical producers, would there be local, foreign, and the government. And our agency interacts with producers and new companies which are planning to enter Uzbek market and develop investment climate for the participants of the market. And our agency, after the administrative reforms were initiated, we have started new format of our activity. Of course, we are well aware that the medicine, I mean healthcare and pharmaceuticals go hand in hand and they complement each other. And our main purpose for our agency, at least, is to ensure accessible and good quality pharmaceutical products to our people, and I would say fulfill internal demand, satisfy internal demand. And of course, in these years, pharmaceutical industry is developing intensively. And if you will look at the volumes of local pharmaceutical production, it tripled in recent years. And in last 5 years, from 140 million of USD is local pharmaceutical market size. So, and actually, last year the production by local companies totaled 400 millions of USD, and export is also growing intensively. Last year, it totaled 90 million of USD. But let us be frank, the number of drugs and medicines is only 20% out of this export, and the remaining, I mean 80%, are various medical goods. We have several companies who have license to produce drugs, and also we have companies who produce various medical consumable and medical equipment. Our audience here in recent years, they are well aware that we have our entrepreneurs who are working in this particular area. And as you have mentioned, we are working proactively at the moment at attracting leading foreign companies, because we have already a pool of entrepreneurs who are working in Uzbekistan, and together with foreign companies we would like to, I would say, have a new production, localized production of pharmaceuticals. And here in Uzbekistan, we have over 40% of pharmaceutical products consumed in Uzbekistan. They are produced locally. Talking about export, which we are trying to promote, as well as to expand the export markets and trace out for new markets, we are paying attention to the quality of local pharmaceutical products, and we are trying to promote our so-called national GMP standards. And I would say among producers of pharmaceutical, we have 35 major producers who are embracing 80% of our local markets, and they have standards of GMP, and they are working, trying to penetrate to export markets based on these standards. And also 65 companies, they are certified under other standards like ASL, and as of 1st January 2024, according to presidential decree, would they be distributors, and GMP, GXP, GPP standards should be applied to all the drug stores and pharmaceutical producers. So we are going to improve the quality of the products which we produce, so to engage foreign companies to promote them. We are going to have in Tashkent and in Tashkent province, we are going to have innovation cluster, Tashkent Pharma Park, which is going to be established, and embracing Technopark and industrial facilities. We are going to have, since this year, since September of this year, we are going to have International Pharmaceutical Technical University engaging leading universities from UK, as well as a Center of Pharmacopoeia, labs and research centers. And we at the adjacent areas there will be an industrial zone located, and we are trying to attract foreign investors and companies to produce new drugs. And we have the package of investment projects, and they at least 10 investment projects totaling 400 million of USD will be implemented there, because this package has already been approved together with the Ministry of Health in the framework of introduction of mandatory medical health care. We are going to work in progress to localize new molecules and new products, and we're going to have so-called 3 years guaranteed procurement, and we are tracing out foreign companies for our local producers. And also we are developing new projects with our foreign companies, and it will help us to promote proper, good quality supply with pharmaceuticals for healthcare industry. And since last year, we embarked on new products development, like diagnostic tools for stomatology, for obstetrics, which we have within, I guess, 1 year, within 2022, we have already localized their production, and we are reducing import of these products. Also, I should mention that if we are talking about our various pharmaceutical groups, we have some significant scope of import, like anti-inflammatory drugs, anti-oncology drugs, and drugs for cardiovascular disease, for angiogenic disease, and antivirus disease. We are importing indeed significant volume of drugs, so we would like to invite all the interested companies to embark with us on production of these products locally, and to provide good quality healthcare products and pharmaceuticals for Uzbek population, and let us work in progress for the sake of a people. Thank you so much. Yes, indeed. We will review the proposals which you have mentioned, sir, and I'm pretty sure that it will be very interesting for our investors. Unfortunately, we are running out of schedule.
Wang Jian, chairman and co-founder of BGI Group. And we know that both innovations, new technologies, and investments play a significant role in shaping the healthcare system and ensuring its its performance. And BGI Group case demonstrates a best practice by bringing all mentioned together here in Uzbekistan. In November 22, the Minister of Innovative Development, together with BGI, has opened a joint venture called Green Screen, which will create a laboratory facility equipped with high-tech and modern diagnostic equipment for neonatal and genetic screening of newborns, children, and their parents. I think in a country as young as Uzbekistan, with such a demography as Uzbekistan, this is really a very important project, and I would like to give the floor to Wang Jian.
Thank you for inviting me to come over to here. And I brought two new technology to here and to share with the people in here. And so what we do is just translate, to push the evidence-based medicine to the precision medicine. Also push the disease care to the prevention things, just move forward. So I and then brought the genome technology and the stem cell technology. We hope those new technology is going to for everyone. It's make it affordable and available, and also it's a brand new things. So what's please the next one? So we propose to the genome for everyone. Now we lower the cost. That means $1 per gigabase. That means $100 per genome. 30-some years ago, China is one of the partner for the Human Genome Project. That time, we sequenced one genome, cost $3.8 billion US. Now we try to drop down to the $100, and we try to quickly to finish 1% of the human population, and even for Uzbek, we say, how about 1% of the Uzbek population? So we try to make sure we have the global standard for everyone, and also for every nation, they have their own standard. And we try to align with the scientists around the world to work together. This is one thing. And next one. And that one, so we have all these automated machines, from the sample prep to the sequencing and to the bioinformatics, from the small scale, from the megabase to gigabase to terabase to petabase, and we have all these machines. And we make it high quality, high throughput, low cost for everyone. If the cost is too high, it's only for the Westerns, there's no way for the Asia countries. Now we try to make it cheaper and high throughput, high quality. Next one. So in China, we are running the biggest, the largest, the genome center. This year, we are going to have 100 terabytes throughput. That means every 2 or 3 days, we can produce 10,000 people's whole genomes. And next year, we will reach the 10,000 genome data per day. It's fully automated, and then there's light-free lab. That means not many people. We need it. Okay, next one. So that one it's very useful for the cancer early detections. We do this in Saudi Arabia for the colon cancer, and also in Rwanda for the HPV screens. That technology is very, very sensitive, and we lower the cost to the just $1 or $2 per testing. So it's make everybody affordable. Next one. And also it's for the birth defect prevention and controlling. Now we are working with, especially for the southern countries, in the Indonesia, and also in the for the thalassemia. They have more than 50% of the population is the positive carrier for this kind of genes. So the thalassemia has become it's become a serious problem. There's 2% of newborn baby to have this kind of disease. For the treatment of thalassemia become the number 3, the cost for the medical insurance. For this kind of disease, we can easily to through the early diagnosis screen to prevent that. And in China, we already, next one, you have a slides there? No, it's not the one. And we already finished the 15 million new, pregnant women screened for the Down syndrome disease. Now we are working in Uzbekistan to try to set up such a platform to make sure there's no serious birth defect. And the second one we brought there is the stem cell. We try to also, the goal for us is make the stem cell for everyone. So everyone has their own stem cell. Again, we have to lower the cost and build a fully automated system. So that one, so we just published the high quality paper in the Nature. So we are loading back the stem cell to the almost as young as the fertilized egg. That means it's very, very young. That we can easily to make new individuals through this cell. So it's a big breakthrough in the science field, but I'm not sure it's for the commercial purpose in the near future. But for the long-term run, I think everyone, even in this room, you ask yourself, you want this stem cell for yourself? I think everybody will answer yes, and we can use this cell for the regeneration of the organs or this to make more young cells. Next one. That's all. So there's new technologies. Probably it's never new in here, but if we can do it, we can achieve it in the labor of your country, in China, not far away. I think you can catch up quickly with us. So we make sure that since we really benefit the people, the world, and make it, it's not only for the healthcare, and also it's the new business for the future. Thank you.
Thank you so much for this impressive presentation of these technological achievements of BGI. Impressive is not only the speed of the technological progress, but also the speed of geographical expansion, that you are particularly active in this region. Azerbaijan was mentioned in the presentation, Uzbekistan. I think that is a very important signal and to the whole region and this particular market as well. I would now come to our concluding speaker, to Zafar Vahidov, partner of Vahidov and Partners. We spoke about government policies in this discussion. We spoke about how investors can be attracted and supported. We saw what actual companies are doing. We saw the experience and best practices that international organizations can bring in. But if we talk about business, then it's clear that the business climate, the regulatory environment is key in kind of any international investment project. But in particular, obviously in life science, for pharmaceutical products, where the protection of intellectual property rights, the fine-tuning of a system between innovative medicine and then the switch to generics is extremely important and has huge both economic and social implications. And I would like to ask you, dear Zafar, in the close cooperation between business and the state, which is the basis for creating an understandable, predictable, clear, and business-friendly investment climate, how do you see the situation here? What are open questions? What are the strong points that international investors can leverage? And yeah, looking forward to your presentation, please.
Thank you, Mr. Schilling. Greetings to all the participants of the forum. Thank you for the hosts for inviting to speak here. Assalamu alaikum, hurmatli forum ishtirakchilari.
Thank you so much, the participants of the forums. Let me proceed in English.
So just, yeah, we have a very kind of brief, just 3-4 slides. Since the topic today is the introduction and basically scaling up of the healthcare insurance in Uzbekistan. Just for a reference, we put Kazakhstan, so don't concentrate, but it's just because we as a firm work in the region, and that's the neighboring country which has maybe started a bit earlier and it has own path again. Doesn't mean that Uzbekistan has to replicate or do the same things, but I think it's still an experience that we should study. So we kind of will cover both. Just about briefly, we are a kind of young firm, still maybe under 2 years, but we have been around advising international pharmaceutical, medical devices, healthcare companies for around 17 years in Uzbekistan and Kazakhstan under different brands, and now we've decided that we want to focus on life sciences, and because we think this is one of the important areas for all of us as people, as citizens, humans. So we've tried to put the structure, there's kind of a flow of the social healthcare insurance. And again, as I said, Kazakhstan is just for the sake of information. Maybe it will be helpful some other local participants as well. But we have tried to put, the thing is, in Uzbekistan, the system is still being built up. There's, as the minister mentioned, there was a pilot project in Sirdarya. Now, within the president's program, it was the Ministry of Healthcare, the fund, were instructed to proceed with the Tashkent city, and we have seen the achievements so far. At the same time, I understand there are a lot of challenges, and I think those kind of challenges have to be decided, together with the international experts, like those who are present here from the WTO, World Health Organizations and other international organizations and companies. So kind of to put here, and I will try to more focus on Uzbekistan. So we see that right now the most of the funding comes to the fund, to the medical insurance from basically partially from taxes kind of payments and from excise excise payments. Basically, it's tobacco companies' funds and alcohol companies' funds. They go into the fund to basically fund those medical insurance for the people. And those funds, then they go to Ministry of Healthcare. Through the Ministry of Healthcare, there's a separate funding for the healthcare organizations. And there's insurance fund, the money that goes to basically to pay within those pilot projects in Sirdarya, for example, and now I guess in Tashkent it's also being built up, for pay for the medical services and medicines, medical equipment, medical devices. And by the way, excise tax is not the only source. There's also the donors and grants from international organizations, from charity institutions, etc. Also quite welcome, and I think that will be very also important in the early stage, especially. There are a lot of international, big, and local wealthy people and wealthy companies who are, happy to share. So this is one of the opportunities, I guess. Then there is a procurement thing for the medicines. For example, we talk about medicines, and since we as lawyers kind of guess more questions on medicines usually, is that there is central procurement and there's decentralized procurement. Basically, there's certain medicines that get procured centrally through the Ministry of Healthcare and its agencies, like Uzmedimpics, for example, and there are certain ones that are being also kind of procured by the local healthcare organizations and centers. And so that's kind of the picture. I will not stop on Kazakhstan, just again for reference. I will prefer to, I know we have not too much time, and I would like to also probably in the end give some remarks on the general framework and maybe answer the questions. So the guaranteed volume of health, previously and still in most of the Republic, there's certain categories of patients which get free healthcare, medical services and medicines, and now the goal of the obligatory social medical insurance is actually to expand those categories to cover more people and all the citizens and foreign residents of Uzbekistan with the kind of free medical aid, and there's also paid services as well. And another brief slide about what does the market look like. So the pharmaceutical market of Uzbekistan has been growing very fast, and we have seen it. It's one of the probably dynamic ones. Obviously, there's 36 million population, as the previous speakers mentioned, and I think it will still continue growing. At the same time, we see the public channel is still probably not that high. It's around 15%, but if you look at what the figures were 5 years ago, it grew dramatically. Like 7 years ago, maybe around $10 million were spent on the procurement of medicines, and now it's around 100 million. So it's a big increase. There's still more to do, and it will have to, I guess, grow and continue both in terms of the coverage difference, the funding. I guess the social insurance will also, the state insurance will enable that. And there's also the public channel will grow, and this will also allow for, more local companies get preferences, etc. That's kind of the main thing from the presentation. Yeah, so I would maybe leave some time. I know we have for some of the questions that you probably have. Thank you.
Thank you very much, dear Zafar. It has been a very interesting discussion. We have been out of time a bit. I don't know from the side of the organizers if we can accept any quick question from the audience. If there is such a quick question.
Last session.
It's the last session. So if there are questions to one of the speakers, please raise your hand and we will give you a microphone. There is a question here.
Microphone, bon.
Thanks for the organization. Thanks for His Excellency. My question is directed for Dr. Ashina, especially please. You have mentioned about the public-private partnership in the focusing on the preventing and prevention for some diseases and especially some programs. So may I ask please if it's not confidential, if there is a specific budget for this year, next year for Uzbekistan? This is my first point. The second point, if you are focusing to participate with only private sector or public sector, for example, to face and like prevent or recover some specific diseases like epidemic disease, some viral diseases. This is my second. Thanks a lot.
Да, пожалуй, я
Discuss more separately because I'm not clear on your second question, but in terms of the budget, so WHO is the World Health Organization, and we are one of the UN agencies. We are a United Nations specialized agency, and we work with 194 member states. Some of them we have a greater presence in, some we have a smaller presence in, but for all our member states we provide technical assistance, global health leadership, advice, norms and standards, and really that's what WHO does. So we don't run projects, we are not a funding agency. Our budget is really about providing this technical advice, policy advice, guidance, and we work primarily with our ministries of health, advising them and guiding them. So we don't run large projects. There are many other agencies, some of the UN agencies, but many NGOs, and we have many of our development partners who actually run big projects. So it depends on what you mean by budget. We have a 2-year planning cycle that we work with our governments with, and we are starting this process. We are working with the Ministry of Health at the moment, prioritizing our, asking them to work with us to prioritize their areas that they want to focus on in the next 2 years. And then we develop a budget according to what those needs are in the country and according to what globally we decide and discuss as part of the World Health Assembly, which is meeting next month. So I'm not sure if I answered your question correctly. I wasn't clear on the second question about public-private. We work primarily with our governments, as I said, but WHO works with all partners, and it's really all about partnership. We have a mandate to convene and work with all partners collectively, so we are always open, always willing to bring everybody on board to work together in support of our governments and ensuring that the people of the world and people in countries which we work have access to the right kind of health services in a way where they are supported. So I don't know if I answered the question, but we can talk separately. Thank you.
Thank you so much. I have received one question online, which is to Zafar Vahidov. You spoke about the differences in the insurance model in Kazakhstan and Uzbekistan, but more generally, as I outlined also in my question, there are some key ingredients, what is needed for a stable investment dialogue to attract new investors to realize investment projects in a country. And what are the most important steps that should be taken to foster this dialogue first, and second, to further ensure the development and prosperity of the healthcare system in Uzbekistan, to make it even more attractive than it is currently to international pharmaceutical companies and manufacturers?
Thank you very much, Mr. Schilling. Yeah, I think that's a good question. I think many things to say, but I will try to be very brief. I know it's the last session, last minutes of our session on the forum. So I think the first important thing that everybody probably understands is transparency and dialogue. So it's very important, and I think already the ministry and the agency are doing a great job that they're very open in their dialogue with the market participants, both existing and those that are coming. I think that it's hopefully, this will continue. This can be done in, both, one-to-one meetings, but also very effectively can be done through the association. For example, there's Association of International Pharmaceutical Companies. There is now newly created Euros Chamber Committee for Healthcare and Pharmaceuticals, which I'm from the chairman of. So there's many things that we can put the dialogue and benefit it. Another thing is, obviously, is clear structure. There is a clarity. We need more clarity on the legal side. So the good side about Uzbekistan legislation is quite flexible. For example, compared to Kazakhstan, you can still do many things the way that would suit both the population, the people, the state, and the market. But I think there should be more clarity, less ambiguity, and more structure. Also, I understand that we talked about the public channel that is being increased. I think that's a good sign, and I think it will help bring more investors and localizations and contract manufacturing in the future. But there is a very important note here. We have to keep the important balance that preferences should not create parasites, as it happens in some of the countries. That is, the companies that locally manufacture but are very economically inefficient, for example, and their prices sometimes are as high as the original medicines, then probably it's not very good for population and the country. So it should be investments not just for the sake of investments, but for the benefit of the people. And when we introduce, there's obviously a big thing about the generics versus innovative. I think we all need cheap, affordable generics, and it's a very, I think, backbone of any healthcare, pharmaceutical market. But at the same time, we should not neglect new innovative medicines that are sometimes much more expensive, but they are able to create better solutions in, for example, one pill treating something, some very difficult disease, right? And for that, we need healthcare economy assessment, pharmac economy, for example. We talk about evidence-based, clinically proven medicines. I think it's very important that Uzbekistan, as the president yesterday, His Excellency mentioned that WTO accession is utmost priority. So I think that will be very important. And regional cooperation, because the companies look for bigger markets. Uzbekistan is a big market, but I think it will be probably more even lucrative and creative if Uzbekistan creates a very favorable economic regime with its neighbors. Then Uzbekistan can export those products. And some few last things about the price regulation, for example. I think it's especially important in the public channel, and we have done some research a couple of years ago on many developed, especially OECD countries, and we can come up with the conclusion that most countries actually don't regulate retail and OTC. So right now the regulation is quite flexible in Uzbekistan, and we hope it will keep, or maybe it will even deregulate, because in Kazakhstan, Kazakhstan has now started deregulating prices for retail. And digital labeling, for example, a very big challenge right now. It's a good thing, but companies hope to see that traceability, that the serialization will actually work in near future. And I know there are a lot of challenges, even those like electricity and internet in remote areas. And so that's kind of it. And obviously, the healthcare expenditure will have to be expanded. The OECD standard is around 4 or 5%. And Uzbekistan, it's, for example, even in Kazakhstan, it's around 2-3%. So that will have to pick up, but I understand it's a challenge because we cannot just introduce taxes and when the economy is growing. And in healthcare, not pharmaceuticals, I think PPP is a very good choice that I think will create very balanced solutions for developing healthcare organizations, institutions, and in Uzbekistan. So that's briefly it. Thank you very much.
Thank you very much, Zafar. We're now at the end of our discussion, and I would like to share with you 3 main takeaways that I have kind of noted for me personally from this discussion. First of all, the first takeaway is that healthcare reforms seem really to work best when they are embedded in a broad stakeholder dialogue, in a broad interaction between different parts of society, government, business, science, etc. And I think the impressive project that His Excellency Minister Inotayev presented today, the introduction of this healthcare insurance in the Sirdarya region, is an excellent example of how it has been done and how it should be done. A second takeaway is that one can leverage to make reforms and projects more successful. One can leverage a whole range of international best practices, but it's equally important to understand the specifics of the local population, of the local healthcare situation, of the local healthcare conditions, the prevalence of certain risks, to actually calibrate very specifically and achieve the best results for the money that is available to be invested. And the third one is maybe the most uplifting, is that while taking into account certain social or healthcare indicators, there might still be some quite important challenges ahead of the Uzbek government, the population, the healthcare system. On the other hand, positive message, and I think that was very well shared today by our Chinese speaker, is that everything is happening simultaneously now. So we are doing some things to solidify the healthcare system and to create some basic institutions, but the most advanced innovations are coming at the same time. And that is, I think, a very positive takeaway from our discussion. And I would like to thank again our panelists, Minister Amrelo Shadievich Inoyatov, Dr. Ashina Khalakdina, Ulugbek Egamov, Wang Jian, and Zafar Wahidov for the very insightful, very valuable, very open also discussion and contributions today. And I wish you a good end of the forum, a nice reception tonight with the organizers, and a relaxing weekend and May holidays ahead. Many thanks.